I'm a fellowship trained breast surgical oncologist. I'm Dr. Amani Jambakar, and a question I get all the time is, how did someone's breast cancer come back elsewhere in the body when they had a sentinel lymph node biopsy done at the time of their initial surgery, which was negative, meaning there was no cancer in the lymph node? So for those of you who don't know, this is a picture of a sentinel lymph node biopsy. A sentinel lymph node means the first 1 to 3 lymph nodes in the chain of lymph nodes, which would be the closest to the breast cancer. It doesn't mean the lymph nodes which are the lowest down, it just means wherever this lymphatic channel takes the cancer first, if the cancer were to spread outside of the breast into the lymph. When a sentinel lymph node biopsy is done using 2 different methods, using this probe and an injection that typically the radiologist does before surgery, as well as an injection that the surgeon does of either green or blue dye during surgery, you have an above 95% chance of finding the sentinel nodes. And if those are negative, then your chance of having breast cancer come back elsewhere in the body is low, but it's not 0. Studies have shown that there is about an 8 to 10% chance at 10 years that breast cancer could come back either elsewhere in the breast or in the lymph nodes or somewhere else in the body, even with a negative sentinel lymph node biopsy or no cancer in the lymph nodes at the time. How can this happen? There can always be one little cell floating around in the bloodstream waiting for your immune system to be down for some other reason to attach somewhere else in the body and start growing. For those of you who have gone through breast cancer, the best way of making sure that the cancer doesn't come back anywhere in the body is to take not just surgery and potentially radiation, but also some type of systemic treatment or a hormone blocking pill or potentially some type of chemotherapy or immunotherapy, which will spread through the bloodstream to any of those tiny little cells and kill them before they have a chance to come back somewhere else. The vast majority of people who have a successful surgery for breast cancer, either lumpectomy or a mastectomy, as well as a negative sentinel lymph node biopsy, will not have cancer come back somewhere else.